Today we're here in London for the first of our national conferences, and the Centre for Workforce Intelligence is pleased to welcome over 200 people from different areas of the country and organisations in health, public health and social care.
The main issues that we clearly need to discuss today is about the workforce of the future. We've got something like 1.4 million people that work in the NHS. It's really important that we concentrate on education, but we also have to spend an equal amount of focus on training of our staff as well.
I think the most important value of this conference is that people come together and discuss the impact of a deteriorating or increasing workforce right here in the now, and also they can plan together for the future implications of any deterioration or increase in our workforce.
I think the major workforce challenges that have to be discussed are the fact that we've got an ageing population with chronic disease. We haven't really got enough people to look after those folk. And so it's how we use technology in a smarter way, it's how we use new models of care, and at the end of the day, the elephant in the room is how we pay for it.
Getting the workforce right is critical to effective delivery of healthcare, and access to good health care is a basic tenet of any decent country. So we need to ensure, particularly in times of cost containment, that we are really getting the workforce element right.
We're in a state of major change, what's called the VUCA world, volatile, uncertain, complex and ambiguous. And the reason for a conference now is to understand how we might make the best of the new system in health and social care.
We've got changing needs of patients, changing demands of patients, and we exercise their needs and their wants through the staff on the ground. So it's absolutely crucial that we come together at events like this and make sure that we're making the right decisions for the patients of today, but more importantly for the patients of tomorrow.
The Centre for Workforce Intelligence is a listening organisation, and so one of the major purposes of our conferences is to hear what people have to say about what they think we should be doing next. And we gather up suggestions, usually over 250 at each of our events, and then we work carefully to categorise those and look at the programme for next year.
The value of CfWI is that it helps us predict the numbers of workforce that we will need in the future. Health and social care is reliant on people, and the numbers of people have to be right to give the right care to our population.
It's really important that we have some national organisations that are able to sort of aggregate and collect data, but much more than that, we need to get to a position where we use that data and turn it into intelligence so that we can make good decision making.
I think CfWI can help enormously by stimulating the community to think about questions they may not wish to answer, but have to be answered.
The value that this kind of event can bring to the system is first of all to bring together 200 people from different areas of the country, different organisations and different levels in those organisations, and they can share, network and get all of the good kind of stuff that can come out of our workshops, our keynotes, but more importantly they can help us take the agenda forward together by contributing on the day and afterwards on our website.
Well, the value we've got from exhibiting is an improved body in social care, as we've been able to talk to a wide variety of people in the workforce world who will provide the workforce that will use our services to drive up the quality of social care.
I think there is a kind of a real consensus about what we need to do to sort of radically sort of transform health and social care.
So for me it's been an invaluable opportunity to hear about things outside London, but also to network and hear some different perspectives.
I'm really thrilled that we've had a fabulous conference today and the feedback has been terrific. People have worked together, thought together, listened together and spoken together, and we think that we've distilled out of the day a lot of work for us to take forward next year's programme.